The following segment is sponsored by Oakview-Medical-Associates.
For many people, Botox injections and fillers are really part of their standard routine. It's not just to soften existing lines, but to minimize the development of strong lines as we age. Dr. Nita Bajor is here from Oakview Medical Associates to talk about it. Hi, Dr. Nita.
Hi, Margaret. How are you?
Doing well. It's good to see you. I know a lot of your patients, the ones that are really keeping up with age management, they're working hard to get in their fitness. They eat well. And many of those are the ones who are really interested in Botox, you say, right?
Yeah, I think skin is a very strong reflection of your inner health. It's the largest organ in the body. And I think once we help our patients get on the path to wellness and really taking care of their nutrition, their sleep, their physical activity, we really incorporate some good skin habits, so to speak, that really speak volumes of their health and internal health, and it gives them confidence. So that's a very important part.
And you get a lot of questions about Botox. First, when should most people consider starting?
Yeah, so Botox or botulinum is a medication, so to speak, that really helps relax the muscles of over the face. And one should think of it, I think it's a good discussion to have with your physician. You know, the cosmetic over-the-counter industry in the malls and stuff, that's over, I think, billions of dollars. And I think having a little more knowledge about what botulinum can do for your skin is really essential, because it'll minimize you from going, to too many places and getting overwhelmed and getting product after product, where you could have just enhanced your skin with something that is actually has medical indications.
And maybe there's not a specific age, but when you start noticing it or thinking about it, that's time to have the conversation. How often do most people end up getting the injections? Just depends on the person?
The injection, the whole treatment peaks at about 1 to 2 weeks after it's given, and then it slowly softens over the next 8 to 12 weeks. So I think keeping in mind that you might need it every 3 to 6 months is reasonable. I have patients that start out, pretty frequently, and then because their lines soften with time, then we end up doing it every 4 or 5 months. And I like that. I've kind of established myself to be known as the one that does it, gives a very natural look, very balanced look, very soft look. I don't believe in doing these injections where you look absolutely stretched. Your face should be a natural reflection of your expressions. Everything should come out very naturally. Yeah. And it should not just take away the lines like that you make when you have strong facial expressions, but also we call them static lines, which are there even without an expression. You may have a very strong forehead line that can really soften with time. So it has a good indication for prevention of getting these lines getting worse as we age.
Well, you talk about the way, Botox can take years off of somebody's face, and it's really empowering for them. What kinds of feedback do you get from people, the patients, once they start getting into Botox and they start liking it?
Oh my goodness, I will tell you, it is so rewarding to see patients. Yesterday I had a lady that had driven 2 hours away to see me because she had heard from a friend that I'm really very conservative. I do a very natural treatment. I make it look very natural. So she came in, and at the end of our conversation, she said, can you just do it now? Because I want to get done with it. I've driven all the way. And I said, yeah, absolutely. And held her hand through it. We really, our pre and post care is very important. That's what I want to strongly emphasize is you must go to a provider, a physician or a provider that does a lot of these. I'm an instructor in aesthetics. I teach other physicians to do it correctly within the standard of care. And a lot of the bad stories you hear around Botox actually or botulinum are only because something was not followed correctly. The injection principles are very good. All the injectors are excellent. So it's a matter of really having that comfort with your provider and making sure they follow up with you, that you are able to access them. There are so many things that go into it. You don't want to feel left alone. You get an injection and you feel your eye is, not exactly the way it should look. Contact your provider that did it. We're here to serve. We're here to help you.
And you're a great resource to talk to when it comes to all these things. There are also other medical purposes for Botox, and you can work with everybody through it. Tell us about your practice at Oakview Medical Associates and your focus on lifestyle medicine.
Yeah, so our practice, Oakview Medical Associates, is in the Five Forks area of Simpsonville, South Carolina. We serve all the communities in Greenville, Spartanburg, just a lot of people coming in. And we also serve as an urgent care, same-day appointments, walk-ins. We do COVID testing. We're really in the forefront of giving you the best care that you need and being accessible. And then the extension of that is if you come to us for some sickness or issues, we want to deal with it. We want to get to the root cause of it and then get you on a path to wellness and really keep you healthy. So we minimize admissions, we minimize ER visits, we reduce the cost of healthcare, and we improve the health of our community. We're in a beautiful area, Greenville. I mean, I'm truly blessed to have found this as a home, came here, established our medical practice, and I feel like, you know, one patient at a time, we can really improve the health of our people. And that's what we're all about.
People love working with you, Dr. Nita. Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville. The number 627-0444 on screen now. Dr. Nita Bajour from Oakview Medical Associates, thanks so much for being here.
Thank you, Margaret.